I'm Alfred Vicencio, the Division Chief of Pediatric Pulmonology at Kravis Children's Hospital at Mount Sinai.
And I'm Alyssa Hackett. I'm the pediatric otolaryngologist also at Mount Sinai Hospital. I think it depends on why they're bringing their child in. As a mom of two young children, I do feel it's important for me to bring my children in for their routine care. I want to make sure that they're up to date on their vaccinations, that we're not falling behind on any of those things, because that's one of the things that I can do as a mom to make sure that they stay healthy despite COVID-19 and despite the risks of bringing them into an office. Now, if we're talking about something that has maybe been an ongoing problem for a long period of time, perhaps a video visit would be a nice way to start a conversation off, either with the pediatrician or with a subspecialist if you need to. But if it's something that I think that now is the time to go and get a lot of your questions answered and to start tying up some of the loose ends that maybe have been straggling out there in the past 3 months. Any concerns that you have about your child's care, really the time is now to get those questions answered.
Young children who are constantly developing and changing, that's a really, really important time for people to seek out routine medical care. We have to remember that for children, routine medical care isn't necessarily coming in with specific complaints or colds or bumps and bruises. A lot of it has to do with maintenance of health, including things like vaccination, and to make sure that kids are growing and developing appropriately. And a lot of people are still choosing to do video visits over in-person visits. We can get a lot of great information by a video visit, but for me as a pulmonologist, there are certain things that I can't do adequately by video visit, which really makes an in-person visit very, very important. I can't listen to their lungs, I can't feel their chest, I can't look in their mouth, I can't look in their ears. And I think that that's something that is going to be very, very difficult to replace.
There are some things that I just can't do over a video visit. I can get a hunch about what might be going on. I can reassure you about certain things, but there's nothing like being able to actually look in your child's ears, to actually be able to see their tonsils, and to really have a good physical exam to help guide our final management plan. So the parents who are coming in, a lot of them have been saying that they've been scared up until this point, but they have a good experience. The wait time is much less right now. I think we're doing a very good job of giving them a time to come in and get them in and through their visit in a more efficient manner. So I think they're pleasantly surprised with the experience that they have.
As a pulmonologist, I see a lot of children with asthma. And one of the things that's very important to remember is asthma is a chronic disease, and it can have its ups and downs throughout the season. Whenever the seasons change, people typically have flares in their asthma symptoms, and those are very, very important for us to maintain and to manage appropriately so that kids don't end up having to go to the emergency room, especially during times like this. Things like pneumonia can turn out to be very, very serious problems if they're not managed appropriately. And even seemingly simple things like a chronic cough may actually be the first sign of something more severe going on, including things like infection or perhaps undiagnosed asthma.
I thought a lot about this during the COVID era. I just thought with my patient population that it must be really frightening to be at home with a child who you're not sure is developing correctly in terms of speech. You're worried they may not be hearing you well. You're seeing them snoring at night. You're worrying that they're not breathing well at night, and to feel like you can't get your child the care that they need right then and there. And those are a lot of the things that I deal with on a daily basis. Something like as simple as a speech delay may be a sign that your child has fluid in their ears. And if they're not hearing you well, if they're not speaking well, then some of their other milestones are delayed. They may be having tantrums that you could control if they were sleeping or hearing better. So especially when you're in this environment where we're all so close in the home, being able to feel comfortable that your child is healthy and that they are hearing you well and that you are communicating well and that they are meeting those milestones, that they are sleeping well, all of those things are very, very important. And I think that that when everything hit back in March, it was very right and appropriate for us to hold all of those things. But now is really the time to come back and to get your concerns addressed and to make sure we're doing everything that we can to make sure your child is growing and developing as well as they possibly can.
Without discounting some of the children that have gotten sick with COVID, by and large, that's the exception and not the rule. Many children either have asymptomatic infections or very mild infections. I myself have had several patients in my practice have acquired infection throughout this time, and we were able to luckily manage them at home with very little consequence. I think that from the standpoint of precautions, I think it is still important to maintain social distancing, washing hands, and overall trying to avoid the possibility of getting infected out there in the general population.
Well, some of the things that we're trying to do, I think that before I start talking about what we're trying to do to make sure that parents feel comfortable, I think it's important to mention that before any of that happens, we had to make sure that our staff felt comfortable coming back to work. Not only our medical assistants who help us room the patients, the front desk staff, and of course the physicians themselves. So we are seeing many patients a day, and especially the doctors and the medical assistants, we're not always able to socially distance. So I want to reassure parents that our staff and our physicians do have enough personal protective equipment to make sure that they are staying safe and healthy, and that they won't be the ones, as much as possible, to infect your child. So I feel comfortable as a doctor going to work and seeing multiple patients a day where I might get coughed on in the face, and knowing that I can go home to my children and I feel very comfortable that I'm not going to be putting my family at risk unduly just by going and doing my job. So that's part one. And in terms of what we're doing for the families, we've reduced the number of patients that we're seeing an hour. We are trying to make sure that there isn't a real waiting room anymore. So you're not in a crowded area with a bunch of other people. We're trying to, as much as possible, bring you directly into an exam room, and we're minimizing the contact that you have with other staff members. In my world, a lot of my patients end up needing surgery. And so, for instance, my surgery scheduler used to meet with you in person, but now she's at home most of the time, and she gives you a phone call afterwards to finish up. So all the things that we can do to try and limit the number of people that you come in contact with, all the disinfection protocols, of course, for each exam room to make sure that we're not transmitting it on any surfaces, and what we're doing for our staff to keep them safe, I think is reassuring to families when they actually come in for the visit.
I think that some of the changes that Dr. Hackett alluded to will be visible to families as soon as they walk in the door. There are people screening at the building entrances, and there are people guiding them into the front desk and back into their exam rooms the minute that you hit the floor. So I think that everything that Dr. Hackett said, we are also implementing throughout the health system in Mount Sinai. From my standpoint, I'm a pulmonologist, and we have a pulmonary function laboratory where children are doing breathing examinations. And we've completely changed the way that we do those. There are certain types of breathing tests that typically we ask children to forcibly exhale and perform certain maneuvers. And we've actually changed the protocols to use different types of tests that make it much, much safer for both our workers and for families.
You know, I think that those families who are coming in for their pediatrics care, I think a lot of them are starting to think about their own healthcare needs as well. One of the parents that I had in my office inquired about some dental and oral surgery needs that he had, because we share an office with our oral surgeons. So I think that when you come into an office and the veil is sort of lifted about how we're managing this situation, you do start to understand that that you may be able to go back and get your routine needs met as well.
Well, telemedicine in the post-COVID world, I think has been eye-opening both for practitioners and for families. Number one, there are many, many practitioners out there that I think we're very skeptical of being able to perform a good history at least a visual examination of a child or a patient. And I think that a lot of people have really come to terms that this is a very, very good way to keep in touch with your physicians, or with your patients rather. On the other hand, I think that families have also been extremely pleased with televisits in the fact that it's very, very convenient for the families. They don't have to get on the subway or get into an Uber and come over to the clinic. They do understand that there are certain things that we can't accomplish on video visits, but I think the reassurance that keeping in touch with their physician on a routine basis and then supplement that with in-person visits has been very, very reassuring for families. Sure. The FPA number for our clinic is 212-241-7788. We would be happy to see your families either by video visit or in person, and we would love for you to be reassured that things will be done as safely as possible.
To get in touch with our pediatric ENT department, you would call our general ENT number at 212-241-9410.